Kendall, moving on to our next speaker, is a board-certified psychiatrist with over 12 years of experience and is currently working in Los Angeles, California.
Physicians take huge risks for speaking out for patient safety. Many have been terminated, threatened from their jobs. Even being at this press conference today poses a huge risk to all of us here, but we feel that the public has a right to know about legislation that's going to affect them. For years, the American Association of Nurse Practitioners has been lobbying to allow nurse practitioners to practice without supervision throughout the many states. Why is that scary? Did you know that an NP degree can be obtained in as little as 18 months online with as little as 500 clinical hours? Compare that to a physician who has gone to medical school and residency with at least 20,000 clinical hours. During the COVID-19 pandemic, the AANP pressured the President of the United States, along with the nation's governors, to loosen restrictions and allow nurse practitioners to practice unsupervised in many states. And in fact, many states did fall to pressure and remove those barriers. But what we saw was that it wasn't that helpful. COVID was very complicated. People were very sick with multi-organ system disease. As we found, NPs lacked the clinical skills to carry out the complex ICU care needed for these patients. And yet, even now, many are still taking advantage of the pandemic to promote a dangerous bill that is currently in the California Senate right now. This bill would allow NPs to practice unsupervised in the state of California. Proponents argue that it would increase access to care and decrease healthcare costs. However, we know that from similar bills that have passed in other states that that argument is wrong. Even in those states, NPs still go to urban areas and they can lead to increased healthcare costs. This bill does not ensure that nurse practitioners go into primary care, nor does it ensure that they go to rural areas. We support the healthcare team model, and many of us have worked with wonderful NPs under a physician's supervision. My own father was actually hospitalized 2 years ago for altered mental status for a month. He was discharged with a diagnosis of dementia and sent to a skilled nursing facility for rehab. One day while he was there, the NP walked into the room where my sister was present with my father and announced to him, "You have mad cow disease," based on a test result that had come from the hospital. This naturally sent my family into a panic, and we had visions of my father dying a horrible death. But as it turns out, what that NP failed to understand was that test result had to be placed within a clinical context. And as it turns out, my father actually has Alzheimer's and is still with us here today. As a physician, a mother, and a daughter of aging parents, this bill frightens me. I'm frightened of the medical errors I've seen, and I'm frightened that this may further decrease access to a physician. And I'm also angry. I'm angry that I may be a patient one day in a system where physicians are no longer present. I'm upset that my children may one day be in the hands of someone that does not have the training of a physician. And I'm also sad that I have to worry about the future and well-being of my patients. As a physician, I can advocate for my family, but what about all of the other people who don't have physicians in their families? Who's going to advocate for them? Thank you for your time.